Welcome to Health Source of Oregon City, Oregon. Today's topic, preparing for spinal decompression. If you're preparing for spinal decompression surgery, there are some things that you'll be required by your doctors to do to prepare, and also some things that you should do on your own to get your body ready. What the doctors require. The doctors will require first and foremost, and most obviously, a basic general medical examination to be followed with a chest x-ray, an EKG, and blood work. As with any surgery, complications can arise due to hidden conditions, so it's always best to find out beforehand if any of these potentially complicating conditions exist so that appropriate precautionary measures can be taken. You may be asked to submit to a psychological or neurological exam. Again, don't be alarmed or offended, just go along with it. You want the doctors to have as much information as possible about your body, because that should enable them to better help you. If you are on a daily regimen of aspirin or anti-inflammatory medications, stop taking them at least 1 week prior to surgery. They're blood thinners, and surgery usually involves bleeding. You want your blood to be able to clot normally. Also, ask your doctor about any other medications you're taking. You'll probably need to stop these at least a few days prior to surgery too. This includes herbal supplements. Anything other than food that you put in your body regularly, your doctor needs to know about. You must not eat or drink anything for 6 to 8 hours before surgery. You'll check into the hospital on the morning of, and you'll have to sign permits for the surgery, anesthesia, blood, and blood products. Give your body what it needs. If you don't already, start eating well right away to build up your body's immunity and healing powers. Especially as we get older, our risk for malnourishment and dehydration increases, partly because our bodies are less sensitive to hunger and thirst, and partly because it's too much trouble to prepare nutritious food, particularly for older people living alone. I know that it is a concerted effort sometimes to force ourselves to eat the right amounts of the right foods, but I promise that once you start, you feel so much better, it's a habit that will be hard to stray from. Especially if you're looking at surgery. Give your body what it will need to heal: fruits, vegetables, whole grains, good fats, and proteins. Relax yourself. Obviously, you can't eat or drink for 8 hours before surgery, but your surgery will be scheduled for the morning, so eat a good dinner at a reasonable time the night before and relax yourself. Watch a funny movie. If your doctor okays it, have a glass of red wine or a cup of chamomile tea to settle your nerves prior to the eating-drinking cutoff time. Try to get a good night's sleep. Remember, being kind to your mind and body in this way will lower your stress level and increase your ability to heal and to get the most out of your reconstituted back. To find out more information on topics like this, please go to www.healthsourceofOregonCity.com.